Okay, regenerative therapy is a new modality of treatment that helps patients with osteoarthritis with their pain, improves their function, and improves the overall quality of life. And the regenerative therapy itself involves using the patient's own body and healing potential to try and get them back to where they need to be. So for example, we use their own blood, we use their own fat cells, we use their own bone marrow to create the stem cells and the platelet-rich plasma, which are all healing factors that help reduce their pain, inflammation, and overall get patient back to where they should be. So mostly patients with osteoarthritis present with pain, stiffness. They've tried a variety of different treatments such as physical therapy, analgesia, and they feel that they're not really improving or being helped with regards to their symptoms. So those are all the ideal candidates who really started on the ladder of treatment but have failed the initial conservative therapy approach. And when we investigate them, they've got osteoarthritis in their joints. But the osteoarthritis has to be early to moderate rather than severe, because with patients with early to moderate osteoarthritis benefit the most from regenerative therapy. So if patients are struggling with pain, with loss of function, with stiffness in their joints and unable to do their routine day-to-day activities or their preferred sporting activities, and they've been told by the doctor that they do have osteoarthritis, they've been started on a treatment pathway with analgesia, with physical therapy, and they feel they're not really making much progress, or not really gaining anything from it, those are the ideal candidates really that will benefit from regenerative therapy. As the next step or next phase of treatment in their treatment ladder would be the regenerative therapy option. So with the regenerative therapy options that we have, which include PRP, which is platelet-rich plasma, the fat stem cell injections, or the bone marrow stem cell injections, patients can benefit improvement in pain. They can benefit from improved function, and they reduce their inflammation in the joints because all these injections act as an anti-inflammatory. And with all of these benefits, they suddenly start getting back to the usual level of activity, start getting back to their normal quality of life, and overall they gain from that. So the complications with regenerative therapies are minimal. The reason they're minimal is that we use the person's own cells and their own body, fat or blood to treat them. So the disadvantages or complications from rejection or reactions are minimalized. There's routine risks, which include risks with any injection therapy, such as infection, which is less than 0.1%. We also have some stiffness and inflammation for a couple of days after the injections, which is again routine. We advise patients to put some ice, take some regular analgesics, and that settles it down. But those are the main risks or complications, if you like, following regenerative therapy.